Hey there folks, welcome back to SG Doctor Wellness. It's Coach Alvin here, and today we are diving into a topic that might be more familiar than you think but often goes undiagnosed. Carpal Tunnel Syndrome, or CTS for short. It's a real pain in the wrist, and we'll tell you more about it today. So, if you ever felt that tingling sensation or weakness in your hand while binge watching videos or typing away, you might want to stick around. Before we begin, give us your support by hitting the subscribe and notification buttons now. We would also like to take the opportunity to thank Logitech Singapore for their partnership in making this episode possible. Carpal Tunnel Syndrome, or CTS for short, is like the villain of wrist discomfort. Imagine this: there's a tunnel in your wrist, a narrow one, surrounded by bones and ligaments. Now, picture the median nerve running through that tunnel. But guess what? Sometimes that tunnel gets too cramped, and that's when things start to go awry. The first step in tackling CTS is recognizing its sneaky symptoms. So here are some red flags to watch out for. Number one will be numbness and tinglingness. If you have experienced a burning, tingling or itching sensation in your palm, thumb or those fingers, you might be a CTS contender. Hand weakness. Struggling to hold on to things like your coffee mug or your phone, that hand weakness could be pointing towards CTS. Short light sensation. Shocking, isn't it? Some folks actually report electric shock-like sensations that shoot up into their fingers. Next will be tingling up the arm. If that tingling decides to travel up your arm, it might even cause you to think that your hand is actually swollen. But here's the kicker: if you ignore these symptoms, CTS can get nastier, leading to persistent numbness, permanent weakness, and muscle wasting in your thumb. So, what's causing all this trouble in your wrist? Here are some of the factors. Number one will be repetitive wrist movement. Those hours of typing or using vibrating tools can put you on the CTS radar. Generally, working that requires your wrist to be subjected to repetitive motions. And if you're doing it in a cold environment, watch out too. The second factor will be medical conditions. So conditions like diabetes, obesity, and arthritis can also be causes to CTS. So can wrist injuries from the past. Gender. Unfortunately for ladies, you are more likely to deal with CTS than gents. Anatomy. Some folks are born with narrower carpal tunnels, setting them up for potential trouble. And also consumption of certain medications, like the ones used for breast cancer treatment, have been linked to CTS. So, how do we keep CTS at bay? Prevention is key. So take breaks. If your daily grind involves repetitive wrist movements, make sure to take breaks. Your wrist will really thank you for it. Maybe you can consider investing in ergonomic gear like keyboards and mice that can keep your wrist in a neutral position. Logitech offers a wide range of ergonomic gear that you can actually consider. For example, the Ergo K860 keyboard, with its split keyboard layout and wrist support, it helps to prevent awkward bending and retains the neutral position of the wrist, where the hand is supposed to be aligned in a straight line with the arm. Another new Ergo keyboard that is worth the mention is the Waves keys. It's generally a smaller form factor than the K860 and has a gentler curvature profile that might be more suitable for those of you who are just starting off assimilating into ergo devices. Mice such as the MX Vertical Advanced Ergonomic Mouse also keeps the wrist in a neutral position and encourages movement of the entire limb rather than just bending at the wrist into moving the mouse cursor. Other mice models includes the Logitech Ergo M575, MX Ergo and Lift, which are all ideal and innovative devices to keep excessive bending and uncomfortable toggling at bay. Now, exercise those wrists. Strengthening your hand and wrist muscles with regular exercises can actually work wonders. Next, consider healthier living. A balanced diet, quality sleep, staying fit, and maintaining a healthy weight can all reduce your risk of CTS. Next will be immobilization. Sometimes wearing a wrist splint, especially at night, can be a game changer. It gives your wrist a break while you catch some restorative sleep. In extreme cases, surgery might be necessary to relieve that nerve pressure. Finally, let's talk about getting that CTS diagnosis. Doctors often use a nerve conduction study, which involves a safe zap of electric currents to check nerve function. And they might use a peripheral nerve ultrasound to confirm the nerve's compression. In conclusion, folks, carpal tunnel syndrome is a common condition, but knowing the symptoms, understanding the risks, and taking preventive measures can make a world of difference. So don't let CTS sneak up on you. Make those lifestyle adjustments and seek medical attention if needed. Your wrist will thank you, and you'll be on your way to a better hand and wrist health. That's all for today, folks. If you found this video to be helpful, don't forget to give it a thumbs up and make sure to subscribe for more health tips and interesting topics. Take care of those wrists, and we'll catch you in the next video.